For more detailed explanations and related topics, we invite you to watch our videos on our YouTube channel. Don't forget to like, comment, and subscribe to stay updated with our latest educational content. Thank you.
Ever felt like your gut's just doing its own thing, completely against your will? That unpredictable rumble maybe, or sudden urges, or just that really frustrating bloating.
Yeah, that sounds familiar for a lot of people.
You're definitely not alone if you have. Digestive issues, they're incredibly common, often kind of hidden, but they can really dominate daily life for millions.
Absolutely.
So today, we're doing a deep dive into Irritable Bowel Syndrome, or IBS. It's, more than just a common condition. It feels like a really deeply personal challenge for those living with it.
And that's exactly what we want to do today, sort of unpack the nuances of IBS. We'll look into its causes, which are still a bit mysterious, actually, and its symptoms, which are really wide-ranging, sometimes surprisingly so. And then the management strategies, there's quite a diverse array available. And look, while it's often a lifelong thing, understanding it is definitely the first crucial step towards managing it effectively and hopefully getting a much better quality of life.
Okay, great. Let's unpack this then. If you're trying to get a handle on what IBS truly is, or how to navigate it, you are definitely in the right place. We've sifted through quite a bit of material for this. So let's start right at the beginning. What is IBS? How do our sources define it?
Well, fundamentally, it's described as a common condition. Affects the digestive system.
Okay.
And the classic symptoms are things like stomach cramps, that bloating we mentioned, and then often diarrhea or constipation, sometimes alternating between the two.
And it's that coming and going that's tough, right? Not constant.
Exactly. That's a key feature. The symptoms, they flare up, they settle down, they can last for days, weeks, even months sometimes. It makes it really unpredictable.
Yeah, and despite being common, the sources really emphasize the impact, don't they?
They really do. They use phrases like very frustrating to live with, which I think captures it well, and capable of having a big impact on your everyday life. It's not just a minor discomfort. It underscores this sort of personal struggle and daily disruption many people face.
Okay, so it's common, it's impactful, but what actually causes it? For something affecting so many, you'd think we'd know.
That's the really interesting and honestly quite frustrating part. The exact cause. Still unknown.
Really?
Yeah. Despite how common it is, there's no single root factor identified. But the material we looked at does link it to several things.
Like what?
Things like how food passes through the gut maybe too quickly or perhaps too slowly. Sometimes a history of gastroenteritis, like a bad stomach bug, can trigger it.
Oh, okay.
Oversensitivity in the gut nerves themselves seems to play a role too. Stress, definitely. And even family history having relatives with IBS.
So it's complicated. A mix of things, potentially.
It seems that way. A complex interplay of different factors rather than one single cause.
Okay. And those factors then lead to the actual symptoms. Let's recap the main ones.
Right. So first, stomach pain or cramps. Often worse after eating and typically feel a bit better after, going to the toilet. Then there's bloating, that really uncomfortable feeling like your tummy's full and swollen. Diarrhea can mean watery stools, maybe sudden urges to go. And the opposite, constipation, involves straining, maybe feeling like you haven't quite finished.
And you said it fluctuates.
Absolutely key. You'll probably have better days and then worse days, flare-ups. And these can often be triggered by specific foods or drinks.
Okay, but it's not just gut stuff, is it? Our sources mentioned other things too.
That's a really important point. IBS isn't confined just to the stomach or bowel movements.
What else comes up?
Well, things like excess wind or flatulence, sometimes passing mucus, a real sense of tiredness and lack of energy can be quite common and debilitating.
Wow.
Even feeling sick, nausea, backache pops up sometimes, and problems with peeing like needing to go often, sudden urges, or feeling like the bladder hasn't emptied properly.
That's surprising, the peeing issues.
It is, but it shows how interconnected things are. Yeah. And in some more severe cases, even bowel incontinence can occur, which is obviously incredibly difficult to manage.
Gosh. So with all these potential symptoms and triggers, what actually causes a flare-up? Is it always food?
Good question. Food is a big one, but not the only one. Our sources point to a few usual suspects. Alcohol, caffeine.
The common vices?
Pretty much. Certain foods, especially spicy or fatty ones, are frequent triggers for some. Stress and anxiety, as we touched on, that gut-brain connection is powerful.
Right.
And interestingly, regular antibiotic use is sometimes implicated as well. But sometimes There's just no obvious reason for a flare-up.
It just happens.
It just happens, which adds to the frustration.
So what this really means for anyone listening is that paying attention, maybe keeping that diary you mentioned, looking for patterns in diet, stress, medication, that can be super insightful.
Exactly. Understanding your own body's responses is key.
Okay, so if someone's listening and thinking, some of this sounds like me, when should they actually go see a doctor, a GP?
Right. The advice is quite clear on this. For non-urgent stuff, if you suspect IBS and you've had symptoms for, say, over 4 weeks, it's definitely time to book an appointment.
And the GP can check if it is IBS and rule other things out.
Precisely. That's a really important part of it, making sure it isn't something else.
But there are more serious signs too, red flags.
Yes, absolutely. And these need urgent attention. So an urgent GP appointment or calling NHS 111 is needed if you've lost a lot of weight without trying.
Okay.
If you're seeing blood from your bottom or in your diarrhea, if you feel a hard lump or swelling in your tummy.
Right.
Or if you're experiencing shortness of breath, noticeable heartbeats, palpitations, or look unusually pale.
And these aren't typical for IBS.
No, definitely not. Our sources are clear. These could be signs of something more serious. So acting fast is crucial. Don't wait.
Okay, that's really vital information.
Yeah.
So say you go to the GP. What happens then? What kind of questions will they ask?
Well, they'll want a really clear picture. So expect questions like, what exactly are your symptoms? Do they come and go? How often? When do they tend to happen? Like after certain foods? And how long have they been going on? They might also do a physical check, usually just gently feeling your tummy.
And I think you mentioned earlier, maybe writing things down beforehand is a good idea.
Definitely a good tip. It just helps you remember everything when you're there and gives the doctor a clearer picture right from the start.
So is there like a definitive test for IBS?
That's a common misconception. It's important for people to know there's actually no specific test for IBS itself.
Oh, okay. So how do they diagnose it?
It's more a process of exclusion. The GP arranges tests to rule out other things that could be causing the symptoms.
What kind of tests?
Usually a blood test that often checks for coeliac disease, and a stool sample test looking for infections or signs of inflammatory bowel disease or IBD.
So they rule out the other possibilities first.
Exactly. If those tests are clear and your symptoms match the pattern of IBS, that's when the diagnosis is usually made.
Right. That whole process really does highlight why being observant about your own symptoms and patterns is so helpful.
It really does. Clear communication makes the diagnosis process smoother.
Okay, so let's say someone gets diagnosed. The focus then shifts to managing it, right?
Yeah.
And the sources said there's no one-size-fits-all fix.
That's the absolute key message. There's no single diet or medicine that works for everyone. It's a very personal journey of finding what works for you.
So where do you start? What are the general do's?
Well, the basics are often the best starting point. Eating a healthy, balanced diet generally. That symptom diary we talked about, keeping track of food and symptoms, is incredibly useful.
Right, for spotting triggers.
Exactly. Staying hydrated is important too. Aim for about 8 to 10 drinks a day, roughly 1.5 liters, mostly water, or maybe non-caffeinated drinks like herbal teas.
Okay.
Finding ways to relax is huge, given the stress link. Getting plenty of exercise helps many people. And one specific suggestion is trying probiotics for about a month to see if they help.
Okay, those are the do's. What about the don'ts? Things to avoid?
Yeah, there are some common pitfalls. Try not to delay or skip meals if you can avoid it. Don't eat too quickly. Many of us are. Try to limit fatty, spicy, or heavily processed foods. These are common triggers.
Fruit. I thought fruit was always good.
It is, but sometimes too much can be an issue for IBS. The advice is generally not more than 3 portions of fresh fruit a day.
Okay.
Limit caffeine, too. Maybe no more than 3 cups of tea or coffee daily. And watch out for lots of alcohol or fizzy drinks.
Right, those trigger lists again.
Pretty much. It's about finding your personal tolerance levels.
Okay, so those are general tips. What about specific strategies for, say, bloating or cramps?
Yeah, the sources offer some specific advice there. For bloating, cramps, and maybe excess wind, eating oats regularly can help. Also trying up to a tablespoon of linseeds or flax seeds daily.
Linseeds, how do you eat those?
You can sprinkle them on cereal, yogurt, salads, either whole or ground. And avoid foods known to be hard to digest for some like cabbage, broccoli, cauliflower, Brussels sprouts, beans, onions.
The usual suspects for wind?
Exactly. And also check labels for the sweetener sorbitol, often found in sugar-free gum and sweets, as that can be a trigger.
Anything over the counter?
Yes. Pharmacists can often recommend things like Buscopan, which is an antispasmodic, or peppermint oil capsules, which can help relax the gut muscles.
Okay. What about if diarrhea is the main issue?
For diarrhea, the advice is often to cut down on high-fiber foods temporarily, things like whole grains, nuts, and seeds. Again, avoid sorbitol.
And medicine.
An over-the-counter option is loperamide. The brand name is often Imodium. A pharmacist can advise on using it, but really importantly, if you have diarrhea, drink plenty of water to avoid getting dehydrated.
Makes sense. And for the opposite problem, constipation.
For constipation, hydration is key. Drink plenty of water. And increase soluble fiber. Soluble fiber is found in things like oats, pulses, carrots, peeled potatoes, and those linseeds again. It helps soften stools.
So fiber can help or hinder depending on the type and the symptom.
Exactly. It's about finding the right balance and type of fiber for your main symptom. And again, pharmacists can advise on laxatives like Fibogol if needed.
Okay, that's really practical. And you mentioned a really interesting practical tip earlier, something about a key.
Oh, yeah. This was a great little nugget. If you worry about needing the toilet urgently when you're out, you can actually buy a special key from Disability Rights UK.
And what does it do?
It gives you access to locked, accessible public toilets across the country, part of the National Key Scheme. It can provide huge peace of mind for people with IBS or other conditions.
Wow, that's genuinely a potential game changer for just being able to leave the house without that anxiety.
Absolutely. A small thing, but potentially massive impact.
So let's say someone tries all these diet changes, the lifestyle stuff, maybe over-the-counter things, but it's still not enough. What's next?
That's when you'd go back to the GP. If those initial steps aren't providing enough relief, there are definitely further avenues.
Like seeing a specialist?
Potentially, or often first, a referral to an NHS dietitian might be suggested. They can offer more tailored dietary advice.
Is that where things like the low FODMAT diet come in?
Exactly. A dietitian might guide someone through a low FODMP diet. It's quite specific. It involves temporarily cutting out certain types of carbohydrates, the FODMAPs, which aren't easily broken down in the gut.
And that includes things like certain fruits, veg, dairy.
Yeah, and wheat products too, among others. It's quite restrictive initially and involves careful reintroduction, so it's really best done with professional guidance from a dietitian. It's not usually a forever diet.
Okay. And what about stronger medicines from the GP?
Yes. If pharmacy options aren't enough, the GP can prescribe other medications. And this is where it sometimes surprises people.
How so?
Because the sources mention medications like amitriptyline and citalopram.
Which are antidepressants, right?
They are primarily known as antidepressants, yes. But they're also used in lower doses sometimes to help ease IBS symptoms, particularly pain.
Why does that work? An antidepressant for a gut problem.
It really highlights that strong gut-brain connection we keep mentioning. These medications affect neurotransmitters, the chemical messengers, in ways that can influence both mood and how the gut functions, particularly gut sensitivity and motility.
Interesting. Are there side effects? How long do they take?
They can take a few weeks, maybe even up to 6 weeks, to show their full effect on IBS symptoms, so patience is needed. And yes, like all meds, they can have side effects, which your doctor will discuss. Open communication is really key if you go down this route.
And if things are really severe,
then a GP might refer on to a specialist, like a gastroenterologist, for further investigation and treatment options.
okay. Beyond diet and meds, what about the mental health side, especially if stress is a trigger?
That's a really important area. If IBS has been a long-term issue, and especially if stress or anxiety seem to make it worse, talking therapies can be incredibly helpful.
Like CBT.
Exactly. Cognitive behavioral therapy, or CBT, is often mentioned. It can help people develop coping strategies, not just for the symptoms themselves, but for dealing with the impact the condition has on their life.
Can you get that on the NHS?
Yes, often you can. In many areas, you can actually refer yourself directly to an NHS talking therapy service. You don't always need a GP referral first. Worth looking into locally.
Good to know. And is there anywhere else people can turn for support?
Definitely. The sources highlight the IBS Network. It's the national charity for people with IBS here in the UK.
What do they offer?
Loads of great stuff. Information, practical advice, an online forum where people can share experiences, which can be so validating, and they also help facilitate local support groups.
So you don't have to feel so alone with it.
Exactly. Connecting with others who really understand can make a huge difference to your well-being.
Okay, just briefly then, since amitriptyline came up specifically, maybe we can quickly touch on what people should know about that if it's suggested for their IBS.
Sure. So, as we said, it's an antidepressant, works on serotonin levels, but for IBS, it's often used in lower doses to help ease symptoms like pain and maybe help with diarrhea too.
Hmm.
It's also used for nerve pain and preventing migraines sometimes.
And the side effects we mentioned. Anything common?
Common ones, especially when starting, might be things like constipation, maybe a dry mouth, feeling a bit dizzy or sleepy, perhaps some difficulty peeing. Headaches can happen too.
Are they usually bad?
Often they're mild and tend to get better as your body adjusts over the first week or two. But, and this is important, people should always talk to their doctor if side effects are bothering them or don't go away.
Absolutely. And you mentioned it takes time to work.
Yeah, usually 2 to 4 weeks to start feeling a benefit for IBS symptoms, maybe 4 to 6 weeks for the full effect, so you need to stick with it initially.
And don't just stop taking it suddenly.
Definitely not. Stopping abruptly can cause withdrawal symptoms like headaches, feeling anxious or tired. Always talk to your doctor about how to reduce the dose gradually if you need to stop.
Got it. Any serious side effects to be aware of? Things needing immediate action?
Yes, though they're rare. Things like a very fast or irregular heartbeat, yellowing of the skin or eyes, jaundice, severe muscle stiffness or confusion, difficulty peeing or not being able to pee at all, severe constipation with a swollen stomach and vomiting. These need urgent medical attention. Call your doctor or 111. And obviously things like signs of a stroke, heart attack, thoughts of self-harm, or a severe allergic reaction require immediate 9999 or A&E attention.
Okay, crucial safety points there. What about practical stuff like driving or drinking alcohol?
Good question. It can make you feel sleepy or dizzy, especially at first. So the advice is usually don't drive or cycle for the first few days until you know how it affects you.
And alcohol.
Alcohol can definitely increase the sleepiness, so it's probably best to avoid it, at least initially while you're getting used to the medication.
What about recreational drugs?
That can be really dangerous. There can be serious interactions, especially with stimulants like cocaine or speed, hallucinogens, and even some painkillers like tramadol. It's vital to be honest with your doctor about any recreational drug use.
Okay, really important safety advice there. Phew, we have covered a lot
We
today.
really have. It's a complex condition.
It absolutely is. We've gone from defining IBS and its, surprisingly varied symptoms right through the whole diagnostic journey, the initial steps with diet and lifestyle, and then looking at the more advanced treatments, the medications, the psychological support, and where to find help.
Yeah.
And I think the big takeaway is, while it's complicated and can really impact life, knowing about these options gives you power, right? And power's choice.
Absolutely. I think that's the core message. The journey with IBS, it's so personal. It takes patience. It takes really paying attention to your own body and working closely with doctors or dietitians. But the key thing is you do have options. There are lots of different things to try, from the simple stuff right through to more advanced therapies. Understanding what those options are is just crucial for finding what actually works for you.
That's such a powerful point about individuality. And it makes you think, doesn't it? Consider how conditions like IBS, with these struggles that are often invisible to others and symptoms that vary so wildly from person to person, it really highlights how unique each of our bodies is.
Absolutely.
So how might a better understanding of these kinds of nuanced, really personal health conditions actually reshape how we all approach health and well-being? Could it foster more empathy, maybe more tailored care in the future? Definitely something to mull over.
For more detailed explanations and related topics, we invite you to watch our videos on our YouTube channel. Don't forget to like, comment, and subscribe to stay updated with our latest educational content. Thank you.